Hi, my name is Carrie Lindner. I am a licensed clinical social worker with Advantia Susquehanna OBGYN, and I am born and raised here in Harford County. If you feel like you are experiencing signs or symptoms of perinatal or postpartum anxiety or depression, we definitely want you to give your OB a phone call. If you also feel like you have a good relationship with your local primary care physician, you can always reach out to them as well. But your OB is definitely a resource to you as far as follow up and getting you connected with the right resources that you may need. The baby blues typically starts within the first 2 weeks postpartum, and a lot of that is just your hormones trying to balance back out after you've had a baby. A lot of times, moms will feel more tearful, crying at times, and they're not really sure why they're crying, feeling a little overwhelmed at times, and also feeling irritable and that things are getting on their nerves a lot quicker than they used to. All of that is completely normal, and a lot of that too is adjusting to having a new baby. Whether you've had a baby before doesn't mean that you will or will not experience the baby blues. There is definitely a lot of hormone changes that happen after you have a baby, and they affect every woman a little bit differently. The baby blues last, like I said, for about the first 2 weeks, and then hopefully you should notice a pretty big difference in your mood as those hormones have kind of balanced back out. You're home, you're getting more of a routine down with baby, feeling a little bit more confident with baby, adjusting to kind of that new role and different family size. But major signs of postpartum depression would be not wanting to interact with baby, feeling like there's a lack of bonding and attachment, not wanting to kind of get yourself out of bed, take a shower, have visitors, people come over, interact, feeling like there's just something missing in regards to your relationship with baby. And sometimes these things can happen right away as soon as you have a baby, and sometimes they can take a little bit longer to surface. So the best thing is to have that support network that can kind of check in with you and ask you how you're doing. And your OB is able to also check in with you postpartum and see how you're feeling. But knowing just the big difference that baby blues is a normal thing that happens postpartum, but if it goes longer than those 2 weeks, or you feel like you are not able to function or care for yourself or your baby, we want you to reach out for help as soon as possible.